Okay, we are officially live for our second virtual speaker series. We're going to give it a minute, let some people enter the room. It usually takes about 30 seconds for people to get in and log in. Thank you guys for doing this today.
Thanks for having us.
Yes,
for this
thank you for having
experience.
us.
Let's just give it a second. All right, so we have 12 so far. Give it another second. All right, we'll start. Oh, 18. All right, we're going to start. Okay. Good afternoon, everybody. I'm Dr. Paul Gazone from Oceanside High School, Associate Principal. I'm here with my co-moderator, Dr. Glicken Rogers, Principal at Oceanside Middle School. And we're here and proud to present to you our second in the series of virtual speakers. So yesterday we had Special Agent Mark Smith from the FBI join us. Today we're fortunate to have Melissa L. and nurses in regional hospitals here. They're here to talk about their profession in the nursing area. I know a lot of you guys probably have questions about the coronavirus and stuff like that, but what we're really going to speak about here is really about the nursing profession itself. So a couple of quick things, right? So for you viewers at home, if you want to participate on YouTube Live, on the right-hand side, you should have a comment box. If you have any questions or comments, you can enter those in that area, and we'll see them, and we'll highlight a couple of them, and we'll let you guys guide the discussion. Anything you want to add, Dr. Glickman?
Nope, that's good.
Okay. So Ms. Leparo, Miss Beach, same thing as yesterday, we like to keep it light here. So I'm not going to refer to myself as Dr. Gazone anymore, or I'm not going to refer to Dr. Glickman Rogers as Dr. Glickman Rogers. We're in our homes. We're not in our office places, right? So please call me Paul. Please call her Allison, and so forth, Alyssa and Kristen, right? Make this a really comfortable and inviting place to talk. So just to get started, I'm curious to see who our speakers, who our viewers are. So if you are a viewer right now, can you just enter in that little text box and let us know what grade level you're at, what community you live in? Because I know yesterday we had someone from. So let us know what grade level you are and what school or community you're part of. And while they're doing that, Alyssa, why don't you start off with just talk about a little bit about yourself, your background, and some generalities about your job.
Okay. Hi, I'm Melissa. I went to school at SUNY Plattsburgh for nursing. I got my bachelor's degree there. I've been a nurse since 2011. I've worked in multiple different departments, which is, the good thing about nursing. You can kind of go anywhere once you graduate. And yeah, right now I work in an emergency room and an operating room in two different hospitals. I have, medical surgical experience, and yeah.
Okay.
I don't know if you can hear me if I'm breaking up because I can't hear anything right now. Okay.
Okay.
You're good.
Go ahead, Kristen.
Okay.
I'm sorry, what was that? I didn't hear you.
Sure. I was asking, just tell us a little bit about yourself, your background, and kind of a little bit, some generalities of what you do.
Okay. Well, thanks for having me, Paul, Allison, and Alyssa. It's great to see you all. So I am a nurse practitioner. I started off my career as a nurse. I went to med-surg initially and then worked in a surgical ICU before becoming a nurse practitioner. And I currently work in cardiology in a cardiac cath lab. So I have a bachelor's degree from SUNY Albany in psychology, and then went back for nursing and have an accelerated bachelor's from New York University, and got my master's degree at SUNY Stony Brook. So anyone that doesn't know what a cardiac cath lab is, we do a bunch of different outpatient procedures, including pacemakers, EP studies, defibrillators, and we do stents. So pretty much anyone that comes in having chest pain or having a heart attack comes to us and we fix them up.
So before we move on, well, Alyssa and
redirect to
Kristen,
Ed, Allison?
can you help us to understand can you help us to understand what's the difference between a nurse and a nurse practitioner?
So do you want to explain, Kristen? Yeah.
Sure. So nurse practitioners always start off as nurses. You have to have at least 1 year of nursing experience before you can continue in most programs, before you can continue on. You have at least a master's degree or up to a doctorate. That's a DN. But pretty much just some additional education and training.
Thank you.
You're back in, Alyssa.
Yeah, okay. Sorry about that.
That's great. And I just want to refer to our comments real quick. So it looks like we have some people from Oceanside High School. We have some people from Oceanside Middle School. We have some counselors on here, some teachers on here, some administrators on here. So we have a wide scope of participants who are viewing this right now. So that's great. And we're excited to have everyone here. So why don't I ask, tell us about, what do you find most interesting about your job? What do you like about your job? Like, you get out of bed and you say, oh, I can't wait to go to work because this is the best part of my job.
You know, one of the greatest things about nursing, which I mentioned a little bit earlier when I talked about my background, is you can do so many different things. Like Kristen's in the cath lab, so she deals with mostly cardiac things. I have 2 different jobs in the operating room, so I get to see surgeries, and one's in the emergency room, which it's an ER, so you see everything. But the greatest thing about when I graduated nursing is you can move around and see what you really like. And there's you don't need a different degree to go into different departments. You can kind of move around how you like and get different experience throughout the hospital or outpatient setting. And that's what's really great about it. And, you know, in the end, you're still taking care of people, which is like I think it's like one of the biggest reasons why people get into nursing to begin with. So it has the same outcome, and you just get to do different departments and you like.
Cool. What about you, Kristen?
Yeah, absolutely. I agree with what Alyssa said. There's kind of definitely somewhere for everyone, different niches. I like that you're able to, move around. Starting with med surg is a good base for anybody, no matter where you potentially could end up. In the surgical ICU was similar to that, more intensive training, and it was surgical patients, either pre or post surgery. And now the cath lab is its own kind of specialized area, but all really interesting places.
Mm-hmm.
Did you always, and you can both answer this, did you always know you wanted to be a health professional or a nurse? How did you decide whether you wanted to be a doctor, a nurse practitioner, or there's so many opportunities in the health field. How did you know, what you wanted to do?
I knew from when I was in middle school, fortunately enough, that I wanted to become a nurse. I don't really know what specifically triggered me to want to, but I always had an interest in hospitals. I didn't want to take the doctor route simply because of the schooling, honestly. Like, it's a lot more schooling than nursing. And it's a totally different type of, it's a different way of medicine. Nursing, you're kind of like a patient's advocate, and doctors, it's very medical, like textbook and diagnoses, everything like that. As far as nurse practitioner, I did originally want to become a nurse practitioner. I just didn't end up ever taking that route, going back to school after I liked what I was doing, and I didn't feel the need to. I just didn't want to anymore.
Okay. So I'm gonna. Kristen, go ahead.
I did not always know I wanted to be a nurse. Initially, I thought I wanted to be a research psychologist, which is why I went for psych initially. Mm-hmm. Right before graduating, I figured out that was not the route I wanted to take. Still initially thought I was going to go into psych nursing, which I still have a passion for, and always found the psych patients very interesting and had a lot of compassion for working with them. Mm-hmm. But ended up going more of a just general medical route initially. So yeah, a little bit of a different pathway for me, but I found my way there.
Okay. So I'm going to highlight one of our questions from our students. All right, so James Solisti from OMS, Team 7-4. He's just curious. You work in a hospital, lots of germs. When you come home, how do you know you're clean? What's that process when you finish, you hang up your scrubs and you get ready to get in your car and go home? How do you make sure you guys are all nice and clean?
Biggest thing is washing your hands. So, I change at work back into regular clothes. I don't wear my scrubs home. And just make sure as soon as I get home, I wash my hands before touching anything, before, interacting with my family. Yeah, that's pretty much the biggest thing. Hand washing is the best way to prevent spreading infection and bringing germs around.
Yeah, and they're pretty strict in the hospital too about standard precautions based on different patients, what you have to wear and use to keep yourself and other patients safe from getting the germs that you could potentially spread to other people. But like Kristen said, hand washing is the number one thing, throughout the entire day and right when you get home. And
Okay, so I'm gonna now highlight one of our counselors' questions from Oceanside High School, but I'm gonna put a little bit of a spin on it. So her question is, what classes in high school were the most beneficial to prepare for the difficult course load you had at the college level? But I'm also gonna actually backtrack this to even middle school, right? So think about some classes in middle school at the foundation level and high school that help you prepare for college and beyond.
mainly the science classes. I feel like I did that mostly in college, and whatever stuck, I kind of carried over. That's basically most of the foundational classes in nursing is science and math. You have to take your other classes, to get all of your credits, but mainly the course load is science and math. So, biology, chemistry, those were all the really big ones. Statistics was actually really big in college also.
Mm-hmm. Mm-hmm. Yeah, absolutely. I agree with that. The math, statistics, if you wanted to do anything within research, is definitely important. But the sciences are the foundation for everything you're going to learn and for everything that you're going to apply to your patients.
Okay.
Mr. Gazzone, I like Joanna Palumbo has a great question. She's wondering if you work mostly with female nurses. I've also I've heard a lot about the shortage of male nurses. Do you know anything about this? And can you tell us about your colleagues?
I find in my area in particular, there's a lot of male nurses. I don't know if it's the nature of being in a procedural area itself, but I would say half of the nurses in the actual cath lab that work directly with the physicians are men. Definitely more men in nursing now. And through my training at NYU, they have the highest percentage of male nurses in nursing school. So I think it's definitely something that you're seeing a lot more of, and it's not so rare anymore. It's great. It's wonderful.
I would say the same in the emergency room. There's a lot of male nurses in the emergency room as well, where I work too.
Okay, so maybe some of this is just perception, right? So maybe some of this is just perception and not reality, and maybe the media has something to do with it. Because when you're watching hospital shows, a lot of times they make female nurses and sometimes I guess male doctors,
Yeah.
But the reality is that we're hearing it from you guys first that that is not what reality is, and there is more of a balance in the gender area of nurses than what we really know. So that's good to know, I think, and thank you for that perspective.
Excellent question.
I'm gonna highlight Jake Cowan's question. So before I get to that, so when I think of this question, I think of the show House. You guys see the show House before, right? Where you have the glass board and they're trying to figure out, the doctors and the nurses, like, what's wrong with him? Why is this person sick? Blah, 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 blah. I agree with Jake and asking, like, is that what hospital life is like? Where, you guys are trying to figure out what's wrong with somebody and you guys are in the room and trying to figure something out. And what are those experiences kind of like? Or is that also just media?
In a way, it does happen. There are certainly challenging cases where you can't really figure out, why or how a person came to get so sick. Typically amongst yourselves and your colleagues and the other members of the team, you are able to figure out what's going on with patients the majority of the time. I would say in rare occasions, yes, there are certain presentations that you can't really figure out. Sometimes abdominal pain can be very vague and you can run all the tests in the world and there's really no specific reason for it. And the patient goes on to recover without needing any intervention. So it's kind of occasionally at a loss for a specific cause, but for the most part, we're able to figure out what's going on.
Mm-hmm. Yeah, and a lot of times also in the emergency room, there's, cases where they'll have complaints and you rule out anything emergent. You rule out anything life-threatening, and that's an actual emergency. And a lot of times, there are times where you say, you have to follow up with your doctor and they'll get further testing that you can't really do in an emergency setting because everything emergent was ruled out,
Can we, Dr. Paul, let's look at this question here about the future of nursing. I've heard a lot about like surgeries that are done by robots and that type of thing. Like, what is how is nursing changed, or, how do you see it changing in the near future?
Yeah, I have seen some robotic cases, which are very cool. They're awesome, the way that it works. And I have seen a lot more now throughout, the past couple of years that surgeons are leaning towards that way. I don't know. It might be a surgeon's preference. I don't know how they determine if they're going to do, robotic or not, or if they want to use the robot or not. But there's more cases that they're starting to use on the robot, which is pretty cool. But there will always be a newer technology. People are always going to be making a newer technology. So,
did you have to get any type of different training? Like, you were accustomed to doing surgery with the actual doctor? Like, has your role changed now that a robot's performing the surgery?
So, as a nurse in the OR, I should be clear, I'm not really right next to the doctor. That a lot of times that's a surgical tech, so it can get confusing. It's kind of a different path.
Oh.
As a nurse in the OR, I'm kind of more for the patient. I get them into the OR. I make sure everything is taken care of before they go to the OR, that they have what they need. So I'm not the person handing the doctor the instruments all the time. I can do that if, but that's not my main role. But as far as the training goes in the robotic cases, there is like a certification, kind of like a class. It's like an online class that you can take to train yourself in the actual robot and how you use it and things like that.
Thank you.
I'm going to highlight a question that you both might have different answers to, by Erwin Nunez. What do you feel is your greatest skill as a nurse? Or maybe most important skill that you might need to be successful? And take that question any which way that you want to take it.
That is definitely an interesting question. I think for me in particular, it's remaining calm when things get a little bit hectic, because that is something that I think helps everybody else stay calm when, a patient is maybe experiencing something as far as, not sure how to word this, but as far as
prioritizing.
Yes, in a way, prioritizing, how to care for them best, especially when it's not going well. So I think that is helpful for the entire team. So especially when you have a doctor as part of your team that's, staying calm and not yelling and, keeping everybody else calm so they can do their job. That's the most important thing. So I feel that's something I typically try my best to do.
Right.
I think as parents and for the students that are watching, sometimes when you go to the doctor or if you've been injured, your parents can be upset and they could be emotional and very nervous. And I think what the nurses are saying, their job, in addition to caring for the patients, is also to keep everybody calm, to calm, and dad and the patient, so that they can best care for you. And that is a skill, because, most people freak out when they see blood or something hurt, and you have a tremendous skill of being able to keep everyone calm so you can take care of the patient.
Definitely.
That's a really good point. Mm-hmm.
Okay. So I just saw an interesting question from Lena Londa, right? So you as nurses don't typically have a 9 to 5 workday, 5 days a week, right? So what does that workday look like? And, do you like it? Pros, cons, things you things that you think our viewers should know?
Most of the shifts in nursing are 12-hour shifts, which I personally love because it's 3 days a week rather than 5 days a week. So you have 4 days off and you work 3 days a week. They are long. You are exhausted by the end of the day. You're not getting anything else done. I mean, I'm not getting anything else done at the end of the day after a shift. I know I'm going right to bed. But then I have 2 extra days in the week to do what I need to do. And that's what I love. There are certain departments that do have 8-hour shifts as well. But you have to keep in mind hospitals, for the most part, are 24-hour places. So you're going to be working holidays and weekends. And if you do 8-hour shifts, then it's 5 days a week. So you kind of get, the days are different. You're not going to be working Monday through Friday.
Mhm.
You know, you put in your Saturdays and Sundays also.
Mhm.
Kristen, you like the flexibility in the schedule for nursing, or are there things that you might not like?
I do. I work 3 12-and-a-half-hour shifts a week. My job is Monday to Friday. We do occasional Saturdays just for a couple of hours to discharge. But I like the flexibility. It's better for my family, for child's care as well. And I think it helps for continuity of care for the patients also. They're not getting so many different caregivers in a day. They're going to have their one nurse during the day, one nurse at night. And then, you know, if you're back for several days in a row, we try to hand off the same patient to each other so that they get to know the same caregiver for a couple of days. And it's not relearning the patient and their caregiver every single day.
Mhm.
So,
Yes, it's important.
Kevin Carbonetti is one of our lead counselor, or our lead counselor in Oceanside. Asked a question: can you talk briefly about any exams you have to take to become an RN, and how best to prepare?
I guess, Kristen, you can go further on the NP exams because I don't really know about that. But I know after you get your nursing degree in college, you do have to take what's called an NCLEX exam. Every nurse has to take it, whether you have your associates or bachelor's. And that's after you graduate and have your degree in college before you can start practicing.
Mm-hmm. Yes, and with the after you graduate from the master's program, you have to take you don't have to take it, but it's recommended that you get certified either by the AANP or the NCAA. It's different accrediting bodies to go on and practice to be an independent nurse practitioner.
So do you need 4 years or 2 years of college to be an RN, associates or bachelor's? For the students, an associates is 2 years. The middle school students aren't up to this yet. 2 years of college, you can earn an associate's degree. 4 years of college, you earn a bachelor's degree. And a master's degree is after college. So what do you need minimal to be a nurse?
They do have associate nursing programs.
Mm-hmm.
I think the job lining now is leading more towards bachelor's, but you can still definitely get your associate's degree in nursing.
Wow.
And then they have some colleges have bridge programs from your associates to your bachelor's.
Wow.
If you want to continue on with that.
Great.
So Ellie Zavon is asking, what is the most challenging aspect of being a part of, I guess the most difficult part of your job? Good question, huh? You guys are thinking.
Yeah. I would say sometimes kind of along the line of what I was saying before is emotions can run high. So, sometimes you get really attached to the patients and it's not a job that you leave at work. You go home and you think about patients when you're not there. You think about their families and how they're doing. And, often you find yourself looking into the patient when you're back from your day off, like, oh, how did you do? How are you feeling today? So I think that sometimes that can be a little hard because it's not something that you're leaving at the door and then, checking out for the weekend or whenever you're back next.
Yeah, your mind is always thinking about them. So.
Okay. So this is a question that I would like to highlight. Where'd it go? Kayla Mulcahy. So you work in a hospital. Lots of things go on, right? There's a lot of good things that go on, but sometimes there are things that are scary, right? So have you guys ever had a moment where you felt scared, and how do you kind of deal with those moments?
I think kind of like Kristen said earlier is not to panic in tough situations, and that will definitely help the entire team when you are scared, whether it's scared about their outcome or, if you're scared about something going wrong or anything like that. The biggest thing I feel like is to remain calm and just keep your head in the right direction, and hopefully, you have the outcome that you want.
Mm-hmm.
Okay. Same for you, Kristen, or a different perspective on that, or?
No, I kind of agree. I haven't ever been scared of my patients. I mean, occasionally you get aggressive patients, if that was the kind of question that they were asking, but I feel that any place I've ever worked has done an excellent job of making sure that you feel safe, that a patient, if they need someone there, a companion to make sure that you're safe, They always do that. I have, as Alyssa was saying, maybe been scared that a patient's not going to do well and that they may not recover. But there's no kind of real way to prevent that other than doing the very best you can to, do everything for the patient.
So we have a number of young learners here. So I think a big part of why we're doing this series is because we want to instill in them a passion for maybe a profession or a career that they might want to pursue, but also the skills, right? Skills are so important because skills are transferable regardless of the career path they choose. In regards to nursing, these students are in middle school. Forget content for right now, right? Forget biology. What skills do you think students need to develop in order to be successful nurses at the heart? What are some things that they need to be able to do?
I think definitely interpersonal relationships, because you're working with people essentially, whether it be the patient, their family, the doctor. So just learning how to relate to people, to listen to what they're telling you. That's very important. So I think that's something that the young people who are listening can, for sure take out of this, that it's important to learn how to relate to people, no matter what job you end up doing. But I think particularly in nursing and any of the health sciences.
I just want to add to the students, you're now in middle school or high school, you can be self-aware of some of your characteristics that might lend itself to the nursing and health professions. Think about yourself. Think about what some of your strengths are. Think about what your peers say, you're really good at, or what they count on you or depend on you for. Think about what your teachers and your family members see in you. It's never too early to start thinking, you know what, I think I am really calm. I am really, sympathetic. I'm really good at helping people when they're feeling anxious or nervous. Maybe I would be a good nurse. Start to think about whether or not this might be a career option for you, because it's a natural strength for you.
Yes, that's an excellent point.
So we are going to wrap up shortly. I do want to answer a couple more questions. First is from another one of my counselors. So we have talked about nursing in the perspective of being in a hospital, right? So the reality is there is more to being a nurse than just working in the hospital if you choose. So can you just talk about that? Because I think a lot of our students may setting. Are there other settings, and what are they that they could pursue as a nurse?
Yeah, there's definitely other settings that you can do. There's school nursing that you can do. There's community nursing. You can be, you can go to people's homes, people who need infusions and things like that in their house, or dialysis. You can do that. Any other ones, Kristen, that are coming to the top?
Yeah, there's even nursing informatics, helping put together policies and procedures. There's forensic nursing. There's often a field as far as like being on crime scenes, which is kind of really interesting. That's
Computer
a little bit
science.
more of a niche area, but yes, outpatient, working in an office setting as well. There's always nursing there.
Computer science, I think, is becoming pretty popular too. Now that everything is electronic, all the medical records are electronic, so you kind of help build medical programs for hospitals and doctors' offices. That's becoming more popular also, that you need to master for.
Cool. So before I'm going to let Allison close this up, but before we do that, I just want to thank both of you for participating today, giving your time and helping our community, and not in many ways, not just participating in this virtual speaker series, but also we all know we're in a difficult time right now, and you guys are on the front lines and putting yourselves at risk for the betterment of society. So for that, we're very thankful, and we're appreciative of everything that you're doing as an adult, as a parent, as an educator. We're very thankful, and again, you guys are the best for doing this. Allison, you want to close this up quick?
Yeah, I think some of the high school students, you've probably already used Naviance to do that inventory, that self-inventory, to identify some of your strengths and to make connections between your characteristics, your strengths and possible post-high school opportunities. Some of our 8th graders, you probably didn't get a chance to do that yet. We were scheduled to do that later this year. But I hope that you'll, watch this series over the next couple of weeks while we're home. And when we do that inventory, you'll take it just a little bit more seriously, because I think you could see today and yesterday, every profession, they're very special. Every profession requires specific characteristics, strengths. The health professionals are very, very special people, and not everybody can be a nurse or a doctor or a health professional. It takes a very unique person, and you might be that person. You might have those skills, that strength, those characteristics. So be mindful of that and think about, is this something that you might be interested in? Because if it is, it's never too early to start gaining experiences, even if it's just talking to professionals in the field, so that you're setting yourself up for success in the future.
All righty.
Yeah.
All right, so everyone, thank you for participating. Thank you for coming back for a second day. Tomorrow, we have our third guest speaker is Caleb Stratton, who's a Chief Resiliency Officer and Business Administrator in Hoboken, New Jersey. He's also the civilian head of public safety, so I'm sure he'll have lots of interesting things to say, especially given the circumstances that we're in right now. So again, everyone, thank you, and that is it for today.
Thanks for having us, Alyssa.
Thank you so much.